My name is Dr. John P. Fischer. I'm a plastic surgeon here at the University of Pennsylvania. An example of a patient that was recently treated here at the Penn Hernia Center was a patient of mine who's a 45-year-old gentleman. He had a previous hernia repair following a colectomy in which he had his colon removed, and he had a recurrence of his hernia. So he came to my office with a fairly large lower abdominal hernia. So when he first came in to see me, we spent significant time going through his history and also obtaining all of his previous operative reports to get a better understanding of his unique condition. And we also talked in a lot of detail about how the hernia bothered him and how it affected him in the activities that really meant the most to him. And we also learned a lot about what types of approaches we could offer this patient based on his unique conditions, including his recurrent hernia, the fact that it was below the umbilicus or the belly button, and the fact that the patient was obese. So we offered several different interventions, including placing the mesh on the inside of the abdomen versus placing the mesh beneath the muscles. Placing the mesh beneath the muscles leads to a lower chance that the hernia comes back, and really that's our goal when we try to fix these more complex hernias, is not have it come back. Because of the different types of techniques that we're able to offer, we were able to use a state-of-the-art type of flap called the TAR flap, which is a transversus abdominis release, where we release one of the inner muscles of the abdominal wall without having to raise any skin flaps up, which means the patient has a lower chance of developing a post-operative wound complication. This patient did great following his surgery. He left the hospital after day 2 and recovered quite well. He's able to go back to doing the things that he really cared about, which included playing sports and really kind of being involved with his 2 children at home.